Hello and welcome to the 2019 National Resource Center for Patient and Family-Centered Medical Home Education Series, Gaining Ground, the Primary Care Pediatrician's Role in Public Health Systems of Care for Children and Youth with Special Healthcare Needs. My name is Lisa Maines, and I will be the moderator today. I'm the Family Support Director at Vermont Family Network and the Program Coordinator for the Family Voices Leadership in Family Professional Partnership. I'm also the parent of two children ages 27 and 22, who between the two of them have or continue to have diagnoses of depression, addiction, and a form of leukodystrophy. My experiences as a mother have driven my work as a professional that hopes to improve the systems of care in mental, developmental, and physical health. This is the third episode in a three-part educational podcast series brought to you by the National Resource Center for Patient and Family-Centered Medical Home, or NRC, at the American Academy of Pediatrics, or AAP. The NRC is being joined by partners in the co-sponsorship of this educational series. This educational series was created in partnership with the Bright Futures National Center, Healthy Tomorrow's Partnership for Children's Program, AAP Council on Children with Disabilities, AAP Council on Community Pediatrics, the Association of Maternal and Child Health Programs, and Family Voices. To learn more about the NRC and co-sponsors, relevant websites have been linked in the bio for this podcast. The NRC is a cooperative agreement between the Maternal and Child Health Bureau of the Health Resources and Services Administration and the AAP. The goal of the NRC is to improve the health and well-being of and strengthen the system of services for children and youth with special health care needs and their families by providing technical assistance and supporting implementation of the patient and family-centered medical home model. By the end of this three-episode podcast series, participants will be able to do the following. Number one, describe the history and purpose of the Maternal and Child Health, or MCH, Services Block Grant, or Title V of the Social Security Act. Number two, discuss the role of primary care pediatricians in state Title V MCH Children and Youth with Special Health Care Needs programs. Number three, identify opportunities for partnership or collaboration between Title V MCH Children and Youth with Special Health Care Needs programs, families, and primary care pediatricians in advancing the medical home model of care for children and youth with special health care needs. Number four, describe benefits of collaboration between Title V MCH Children and Youth with Special Health Care Needs programs, families, and pediatricians. The focus of this episode is opportunities for partnership between pediatricians and Title V MCH Children and Youth with Special Health Care Needs programs from the state perspective. It will feature a conversation with Dr. Manda Hall, Pediatrician and Associate Commissioner for Community Health Improvement at the Texas Department of State Health Services, and Tom Scholes, a pediatrician, AAP member, professor of pediatrics, Director of the Division of Child and Community Health and Child Health at the University of Iowa, the Director of the Iowa Children and Youth with Special Health Care Needs Program, and a member of the National Resource Center for Patient and Family Center Medical Home Advisory Committee. Towards the end of the episode, we will share a list of resources discussed during the conversations, as well as additional resources that can support participants in medical home implementation. I would now like to begin the episode by asking our speakers to introduce themselves and provide an overview of their involvement with Title V MCH Children and Youth with Special Health Care Needs programs. There is also a great deal of variation among Title V MCH Children and Youth with Special Health Care Needs programs. Can you also provide a high-level overview of this program in your state? Dr. Hall, would you like to begin?
Thank you, Lisa. I began my career in public health as the Title V Children and Youth with Special Health Care Needs Director in 2012 here in Texas. I then had the opportunity to serve as the Title V Maternal and Child Health Director. Currently, I serve as the Associate Commissioner for the Community Health Improvement Division at the Texas Department of State Health Services, and the Maternal and Child Health section is one of 4 areas under my direction here in Texas. In Texas, the Maternal and Child Health and Children and Youth with Special Health Care Needs programs funded through the Title V Maternal and Child Health Block Grant are situated within the Texas Department of State Health Services, which is our state public health department. The Children with Special Health Care Needs Systems Development Group implements our Children and Youth with Special Health Care Needs programming and works to strengthen community-based services to improve systems of care for children and youth with special health care needs and their family. Our program focus includes medical home, transition to adulthood, and community inclusion for children and youth with special health care needs and their families.
That's great. Thank you, Dr. Hall. Dr. Scholes, if you could now tell us a little bit about yourself and your program in Iowa.
Well, thanks, Lisa, and thanks for the great introduction earlier. I serve as the Director of Iowa's Title V program for children and youth with special health care needs. And in Iowa, the Title V Maternal and Child Health and Children with Special Health Care Needs program is actually split between 2 different organizations. The Title V MCH component is overseen by the Iowa Department of Public Health in Des Moines, Iowa, whereas our Title V program for children and youth with special health care needs resides within my Division of Child and Community Health in the Department of Pediatrics at the University of Iowa. And as I'll talk in a little bit, that provides us an opportunity for some interesting synergisms. For Iowa's Children and Youth with Special Health Care Needs programs, particularly relevant to this podcast, supporting medical home for children and youth with special health care needs is a state priority for our Title V Children and Youth with Special Health Care Needs program.
Wow, we're very fortunate to have both of you with us today for this podcast. You both have a wealth of experience, and the differences in how your programs operate and where they're housed will be a great comparison for all of us to hear about. In the first episode of this podcast series, faculty discussed the formation and function of the Title V legislation and its role in supporting systems of services for children and youth with special health care needs. In the second episode, real-life examples of partnerships between primary care pediatricians and Title V MCH Children and Youth with Special Health Care Needs programs were discussed from the pediatrician perspective. In this episode, we would like to hear from you as Title V MCH Children and Youth with Special Health Care Needs leaders about real-life examples and opportunities for collaboration with pediatricians. From your perspective as a Title V MCH Children and Youth with Special Health Care Needs Program Director, can you discuss how you have successfully partnered with the pediatricians and any tools, resources, or strategies that made this possible? Dr. Hall, would you like to begin?
I'd be happy to, and I have a few different examples that I would like to share today. First, our Title V Children and Youth with Special Health Care Needs staff are currently participating in the Children with Medical Complexity Collaborative Improvement and Innovation Network, affectionately known as COIN. Through this project, our team is partnering with a primary care clinic dedicated to the care of children with complex medical issues, as well as partners at Medicaid, managed care organizations, families, including our State Family-to-Family Health Information Center, and other key stakeholders. This clinic was started after our Title V program funded a pediatrician to conduct a needs assessment that indicated the need of this type of clinic within our community. The COIN was designed to improve the quality of life for children with medical complexity, the well-being of their families, and increase the cost effectiveness of their care. So far, the Texas team has seen progress in reducing readmission rates for children cared for in this clinic. One resource that we have worked on is the Texas Health Steps online provider education modules through our state Medicaid program. One activity of the program is to educate providers of existing medical, dental, and case management services through online provider modules. Children and Youth with Special Health Care Needs staff partner with Texas Health Steps in the development and promotion of these modules to help educate providers, including pediatricians, on children and youth with special health care needs related health care topics. Our staff contribute to course content, and we provide linkages to subject matter experts. One of our most popular modules is the Building a Comprehensive and Effective Medical Home, and we recently launched the module Family-Centered Care Primer for Pediatric Healthcare Providers. And then finally, our program has helped develop a healthcare transition resource guide for providers that are based on GOT Transition's 6 core elements of healthcare transition.
Great. I love that you include your Family-to-Family Health Information Center so much in your work in Texas. This must help a lot to ensure that family-centered care is truly driven by the input and participation of families who are living the experience. Dr. Scholes, we'd now love to hear your response to question number 2.
Sure, Lisa. In Iowa, the Title V Children and Youth with Special Health Care Needs funding really provides foundational support for all our programs. We have other funding sources that we merge with the Title V funds, but the Title V Children and Youth with Special Health Care Needs dollars really provide an opportunity for us to maintain 14 regional centers around the state that are mainly located in rural areas around the perimeter of Iowa. Within these regional centers, we have about 105 staff. And among those staff that are there on a daily basis at those regional centers includes a secretary, a registered nurse. Most of them have advanced nurse practitioner in each of those areas, each of those centers. We have a social worker in most of our centers. We get dietitian support through telehealth to all our regional centers. And each of our regional centers has a family navigator to provide family-to-family support. And our family navigators are parents of kids with special health care needs, and they really provide wonderful lived experience for families that we're serving at the regional centers and are also a great conduit for opportunities to engage the community, as well as they help communicate with the medical home and the primary care providers in those communities. It's important to note that our services that we provide at our regional centers are all gap-filling. We try not to duplicate any services, whether they be mental and behavioral health or kids with medical complex conditions. We attempt not to duplicate services that are available in communities. As I mentioned, we're housed within the University of Iowa, and within the relationship we have with the University of Iowa, we're able to develop quite a bit of synergy with services and resources available through the University of Iowa healthcare system, as well as the University of Iowa Carver College of Medicine. We take great advantage of the electronic medical record that the University of Iowa hospitals and clinics utilizes, such that all families and patients being seen at our regional centers have an electronic medical record that can be shared across regional centers, as well as allow for primary care providers in the medical home for the patients we're seeing to be able to tap into that medical record to get up-to-date information about kids that are being seen in our clinic. We also take advantage of legal services, HR services, and information technology backup that's provided through the University of Iowa. So we're really able to extend those Title V Children and Youth with Special Health Care Needs dollars. I also want to mention that each of our regional centers has telehealth infrastructure. And again, in partnering with the University of Iowa Carver College of Medicine and the specialists who are available through the College of Medicine, we're able to provide telehealth services in gap-filling ways to many of the kids and families we see at our regional centers. And last year performed over 2,000 telehealth visits, the majority of those in mental and behavioral health areas. And again, those services are meant to support the medical home of the kids and families that we're seeing and not to compete with them. Recently, we've been able to build on Title V MCH and Children and Youth with Special Health Care Needs funding in the state through the HRSA-funded Pediatric Mental Health Care Access Program. And this funding through HRSA has allowed us to establish regional pediatric mental health teams where we're able to connect pediatric providers in communities with mental health providers through regional conferences as well as through online webinars that our program is able to provide. And also in partnering with our child and adolescent psychiatrists at the University of Iowa, we've been able to support primary care providers and medical home and their medical home with mental health guidance to keep the kids in their medical home with this 24/7 available mental health and behavioral health consultation line.
That's great. And I know your Family to Family Health Information Center in Iowa is actually housed at the university also, so it's just really great to hear how closely you both are working with families. And the rural piece is so important. Telehealth is promising in being able to reach families without the stress of them having to travel far for appointments during what is certainly a very busy life already for them. I'm wondering, as a follow-up question, did you face any challenges in building partnerships? And if so, how did you overcome those challenges? And Dr. Hall, would you like to begin?
Sure. So as people are aware, Texas is very large. We're very diverse in our population as well as geography. So all of this has to be considered when we're building programs to support children and youth with special health care needs and their families. And we've employed many different strategies to address this issue. First, we have Department of State Health Services regional staff that are throughout our state's public health regions. And so they are able to work directly with our children and youth with special health care needs and their families, providing case management services. This helps to ensure that children and their families are being linked to the appropriate services and supports that are needed within their communities. We also work with local community-based organizations that allows us to implement programs at the local level. This includes both contractors who provide case management support as well as family support and community resources. We also partner and develop relationships with our Texas Pediatric Society and the Texas Medical Association, both of who can reach pediatricians and providers throughout our state. And then where we are able, we employ technology. This allows us to be able to host webinars and use video chat where we can. This allows us to be more interactive in our meetings and our conversations when we aren't actually able to get people in a room together.
Great, thank you. And how about you, Dr. Scholes?
Well, I think one of the biggest challenges for our regional centers is, to some extent, the siloing of services that kids with special health care needs and their families face. And those silos, though people have the best meaning intentions, can often be set up between schools, between healthcare providers, and between other people providing services for the kids with special health care needs that are often very complex. And overcoming those silos is something that we've worked very hard with not only our staff but with our community partners to overcome. I think that communication becomes critical into those circumstances, and it's something that our family navigators have done a wonderful job working with families to help make sure that they're identifying what the primary goals of that family are and making sure those goals are communicated to the schools, to the medical home, as well as to the other service providers for that child. And really just coming up with ways to improve communication between those various groups. And often it requires in-person involvement. For instance, many of our family navigators will attend individualized education program meetings at the schools in an effort to better understand what challenges the schools may be facing and communicating those not only to families but back to the medical home. So really breaking down those silos, I think, is always a challenge and something that we continue to work on in an attempt to do better.
Thank you very much. You both discussed very diverse examples of how your programs engaged with pediatricians. The systems that serve children and youth with special health care needs are complex and multidisciplinary. We'd now like to hear about how the benefits of these partnerships or specific improvements you have seen in serving children and youth with special health care needs, such as implementation of programs or increased number of children receiving care within a medical home model. Dr. Scholes, would you like to begin?
Well, yes, and I think I will begin by reiterating that communication is key. Communicating with the medical home and communicating with other service providers for children and youth with special health care needs is really a very important step in making sure the kids are getting the best care possible. For ourselves, one of the ways we communicate with the medical home is to provide online access to the electronic medical record to the primary care provider in the medical home. That allows them at any time to be able to tap into information that our nurse practitioner may have gathered during their medical assessment of a child, or that our family navigator may have determined in conversations with the family as they attempt to identify and prioritize the goals of the family. We also provide direct contact with the primary care provider in the medical home through phone calls and through letters and fax materials. Still in this day and age, old-fashioned phone call and or fax is often the most effective way to connect with some of the providers in the rural communities where our families live. And another important way I think that we're able to attend to the needs of kids with special health care needs is to be sure the family is driving the process. The family is the one we turn to define the goals for their child. The family is the one who defines who in the care team is important for them to update and communicate with. We may provide guidance, we may provide suggestions for goals and for who to communicate with, but having the family make sure that they're the ones leading that process, making sure that they're the ones who feel like they're empowered is really, really critical for making sure their children are getting the best care possible.
That's wonderful. The family driving piece is so important, and certainly what works well for one family is not necessarily what other families would prefer. So Dr. Hall, we'd love to hear your response to question 3 now.
Sure. So working in public health, part of our role is to actually serve as a convener. And so we bring people to the table, which allows us to focus on improving outcomes for different maternal and child health populations, including children and youth with special health care needs and their families. Our Title V Children and Youth with Special Health Care Needs program actually facilitates 2 learning collaboratives here in Texas. One is focused on medical home, and one is focused on transition to adulthood. The Medical Home Learning Collaborative actually began in 2003 as a work group. There were participants who had attended an American Academy of Pediatrics conference and then spearheaded efforts to encourage Texas providers to establish medical homes. The mission of the Medical Home Learning Collaborative is to enhance the development and promote the principles of the patient-centered medical home model within the state of Texas for all children and youth, including those with special health care needs. In addition, we facilitate and support the Transition to Adulthood Learning Collaborative. This group is working to promote a collaborative approach to the provision of transition services for youth in Texas with disabilities and special health care needs in their families. Both of these collaboratives work through a strategic plan that the members have developed, and they meet quarterly via conference call so that we can share knowledge, implementation strategies, and best practices. Providers, youth and young adults, parents, caregivers, representatives from healthcare plans, hospitals and university systems, and local community organizations all participate, and in fact these groups are open to the public. Being able to facilitate these groups allows my team to identify key priority areas and explore potential solutions within our state. As I mentioned earlier, we also fund community-based contractors to ensure case management and family support and community resources are accessible throughout Texas for children and youth with special health care needs. Contractors help ensure that clients are connected and active with a pediatrician or a primary care provider. And then through this funding, we've actually had the opportunity to provide funding to 2 medical home support contractors to help enhance infrastructure and work that they're doing around medical homes.
Thank you. Wow, as you mentioned, Texas certainly is vast. It sounds like you both have taken great steps to address the unique challenges of your state. Thank you both so much for sharing these great experiences. Now on to our next question. If you had to share one lesson learned with the audience about medical home systems building efforts, what would it be? Dr. Scholes?
Well, I would go back to making sure that families are incorporated into all levels of decision making. I never fail to be surprised at the unique solutions and unique barriers that families identify that are critical to them in helping to support and provide optimal care for their child with special health care needs. So I just always am so thankful for that unique and often insightful perspective that families are able to provide, and I could not encourage strongly enough that as people consider building systems for medical home, that parents are included in that decision-making processes.
Well, as a parent myself, I'm sure you know how I feel about that answer. How about you, Dr. Hall?
Thank you. I am really going to echo what has already been said. We know that in order to build a successful medical home system, you have to have your key partners at the table, and families are key to this partnership because they bring unique perspective, voice, and knowledge about children and youth with special health care needs to the table. In Texas, our Family to Family Health Information Center are one of our key partners in many of our initiatives, and we know that engaging families early and often are key to systems building efforts.
I'll say again, it's really great to hear how much both of you work with your families, and also great to hear about a focus on transition. As a parent of 2 young adults who have experienced disabilities, I know firsthand how difficult the transition is for families and youth. I'm wondering, what would you recommend to a listener of this podcast do within the next month to build or enhance partnerships with Title V MCH Children and Youth with Special Health Care Needs programs? Dr. Scholes, would you like to go first?
Sure, Lisa. I guess would recommend that a listener reach out to their Title V MCH Children and Youth with Special Health Care Needs directors or director in their state to better understand the services that Title V is supporting within their state. By doing this, I'm certain that they'll be able to enhance the services they're providing to their families, and will be able to build new partnerships that will be something that carries forward in the years to come to continue to improve upon the services they can provide for children and youth with special health care needs in their state.
Wonderful, thank you. Dr. Hall, how about you?
I completely agree. If you have not already established a relationship, reaching out and connecting with your state maternal and child health and children and youth with special health care needs programs is key. Find out who the directors are and reach out to them. We love to hear from folks who are interested in partnership. Contact information for the directors can be found on the HRSA Title V website and would be a really great place to begin.
Fantastic. Well, thank you, Dr. Hall and Dr. Scholes, for sharing your experiences with us today. Thank you, too, for sharing tools and resources available to the public to learn more about this topic. We greatly appreciate your time and insights. All the resources discussed during this episode can also be included as a PDF and archived on the National Resource Center website. If you would like to be connected with Dr. Hall and Dr. Scholes or have any technical assistance needs, the National Resource Center staff are available to facilitate introductions and provide tools and resources. On the National Resource Center website, below this recording, you will see a link to a short evaluation survey for this podcast series. We would greatly appreciate your feedback. This concludes the 3rd episode of Gaining Ground, the primary care pediatrician's role in public health systems of care for children and youth with special health care needs. Thank you so much for your participation.